American healthcare system is badly broken.
The present system doesn't work, and it's going to take us down. We need a whole new kind of medicine.
We're in the grip of a very big industry, and it doesn't want to stop making money.
If I spend 5 minutes with you and then put in one of these stents, I probably get paid $1,500. For me to spend 45 minutes with a patient to try to figure out what their true problem is, probably get paid $15. It's a completely irrational system.
We don't have a healthcare system in this country. We have a disease management system.
We're spending almost twice as much in America as any other country on earth, but our lifespan isn't even in the top 20.
30,000 Medicare recipients die each year from care they didn't need. That's the equivalent of a jumbo jet crashing every single week. If the aviation industry killed as many people, we'd be up in arms.
The administration pays you based on how many patients you see. All right, who's next? If you try and buck the system, someone says, what can we do to get your productivity up? I'm not interested in getting my productivity up. I'm interested in helping patients.
We're seeing the military just being a microcosm of the problem society's having.
Soldiers' use of prescription drugs has tripled in the past 5 years.
This medications I was on.
Only by accepting that the American healthcare system is badly broken will we be able to seek out the escape fires, the potential solutions. There are answers.
One company has figured out how to lower healthcare costs by more than 40%.
We provide incentives for people to engage in healthier behaviors.
The Army Surgeon General directed that we establish the Pain Management Task Force to take a look at alternatives to narcotics.
I was skeptical, so skeptical.
I've gotten a lot of inspiration, a different perspective. There's a different way of doing things that is possible.
If I think about what healthcare could be like, it would have a lot more care in it.
The healthcare system is unsustainable. We're really mortgaging the future. Not just the health of healthcare, we're talking about the health of the nation.
Hi there. How would you like to live out the rest of your life not being fat, sick, and generally depressed? Well, unfortunately, that's where most of us end up, later on in our lives, and then having to have somebody else take care of us, unless we take the appropriate steps to make sure that this doesn't happen to us. And that's what I want to be talking to you today about. I'm Dr. John Filippini, and I'm going to be sharing a little bit about who I am, what my credentials are, why I'm so passionate about the things I'm going to be sharing with you today. I'm also going to be sharing a little bit about how we're getting the results for our patients in our office. Now, I can't go into a lot of detail about that because it's too overwhelming. It would take days, but I'm going to give you enough information so that you can decide for yourselves, hey, does this guy make sense? Does what he says have a ring of truth to it? And if it does, would you be willing to make these lifestyle changes to get your health and your life back? And if you would, I'm going to give you an opportunity that will change your life. And I tell you, it's an exciting life that you can have once you get your health back. But today I'm here as a messenger of truth. I want to give you the right information about how to protect your health or how to get it back. But information isn't power, right? Information, as we've told, is power, but it's only power when you do something with it, when you have a system that's going to implement it and get you the results that you need. Now, whether you're watching this today because you're concerned about cardiovascular disease or your diabetes, maybe Alzheimer's, cancer, whatever the condition is, you're going to understand why our current healthcare system just doesn't work for chronic illness and disease. But I'm going to show you the appropriate steps that you can take so that you can start to get the results that you're wanting. I want you to understand it right up front. I'm not a medical doctor. I'm not an endocrinologist. I'm not a gastroenterologist or a cardiologist. I'm not a neurologist. I'm not a psychiatrist or psychologist. In fact, I received my doctorate in chiropractic care back in 1988. But my postgraduate education has been in functional medicine, functional neurology, as well as some energy medicine. I'm also a doctor of pastoral medicine, and what that is, it's a kind of a membership. You have to become a member of the Pastoral Medical Association to be seen by me in my office here. But it doesn't cost anything. It's free. It's just you're going to be coming in with a sense of something different happening here. We're not going to be using your conventional drugs and medications and surgery and everything to try to get your health back. In fact, I think we're going to be using something that's much more in line with what God's plan for your life is. So yeah, I do pray for my patients, but I don't have any supernatural powers, no more than anyone else. And in fact, I don't even treat disease. But that's not to say that I don't get the results from my patients that they want. Do I help people lose weight and get their hormones balanced out, reverse their diabetes, recover from thyroid and autoimmune diseases and things like cancer? Well, yes, because what I do is I look for the underlying cause of why a person became a diabetic or lost thyroid function, or why their systems are starting to get all out of balance and falling apart. And then I help them to get off of their medications and to avoid surgeries, and help them to attain the healthy, abundant life that God truly intends for all of us to have. Now, do you believe that you were put on this planet for a reason? I hope so. I do too. I don't know about you, but do you feel that you have accomplished that that purpose in life, or are right now taking the steps to accomplish that? Well, I feel so blessed to say that I'm doing just that right now, by being able to help you to get your life and your health back. But you know what? I couldn't do it unless I had my own health. Because when you don't have your health, you certainly can't hold down a job or run a practice. You don't feel like getting outside and doing things and enjoying sports and hobbies. Your relationships start to suffer. And in fact, your life just starts to fall apart, and life just starts to suck. Because our health is our most important asset, and without it, nothing else seems to be as enjoyable as it could be, and for most people it's not even enjoyable at all. And with diabetes, it's just that much more, because with diabetes you're going to find that you're going to be put on medication after medication, and that's slowly going to rob more and more of your health right out of you. Something's causing us to be sick. And let's just take a moment to talk a little bit about that, because that's what we're going to be addressing. But 50 years ago, we didn't have nearly the amount of diabetics that we have today. In fact, it's getting worse and worse. But that's not the only thing that we're seeing. Look at things like cardiovascular disease, or cholesterol levels. We have everybody on these statin drugs, and yet we have higher rates of heart attacks and strokes. That doesn't make sense, does it? How about things like cancer? Yeah, we declared war on cancer, back in the Nixon administration. But what used to be, I think, 1 out of 22, 23 people had cancer. 40% of us have cancer today, or will develop cancer in our lifetimes. And look at autism, things like that. Everything is getting worse, and something is causing us to become more and more unhealthy. And these are going to be things that we talked a little bit about today, but it's going to be things like what they're doing to our food supply. It's the heavy metals and toxins, the toxins that they're putting on our foods, spraying in the air. It's our no exercise. We're getting pretty. We just don't like to move, right? You want to get as little exercise as possible, so our lives have become very sedentary. So that's something that we have to address and get you going on that. But there's other things that you don't really have control over, like EMFs that are being bombarded through your body from all these wireless devices, the sprays in the air and things like that. But there are ways that you can protect yourself, and we're going to talk a little about how we do that and how we teach our patients to do that. So let's talk a little bit about what diabetes is. And diabetes has tripled since 1980, and it's actually projected to triple again by 2030. So yeah, these numbers are really going up. 29 million people today are diabetics, and another 79 million are pre-diabetic, or what we call insulin resistant. Now, diabetes is the #1 cause of blindness and kidney failure. That's pretty sad. And diabetics are 4 to 5 times more likely to have a heart attack or stroke than a non-diabetic or non-insulin resistant patient. And 70% of diabetics will develop a neuropathy in their lifetime, even if they're on medications. And I'm going to stress that even a little bit more, especially if you're on your medications. Now, the sad thing about diabetes is I don't know what the mortality rates for that are, because they're kind of buried in a lot of these other diseases. For example, with heart disease, 75% or 70% of diabetics die of heart disease. So 25 to 33% of heart attack victims have diabetes at the time. Another 25% of those heart attack victims have pre-diabetes or insulin resistance. So what that means is that over 50% of heart attack victims have died from insulin resistance or diabetes. And heart attacks, heart disease is our #1 cause of death in our country right now, as a close second to cancer, but all the diabetics are getting included in that category. So how many of those heart attacks are actually caused by the diabetes or the insulin resistance? So it's kind of sad that we can't figure out what those numbers are. Now, we have been taught how to take care of ourselves differently than we learned as kids. When we were younger, we used to think, okay, well, it's sort of like this plant here. If we saw this wilted plant, we have this natural intelligence that we were taught by our parents, our grandparents, or our teachers maybe. If a plant looks like this, we had this wilted plant, what's the first thing you want to do? Well, you want to add water, right? Okay, well, if that doesn't work, what's the next thing? Put it in the sunlight because it needs its nutrition through photosynthesis. Well, if that's not doing it, then what we want to take a look at? How about the nutrients? What's in the fertilizer? What's going on with the food intake that this poor plant's getting? Well, there's one other thing that we might not be aware of, and let's say somebody's sneaking in our house in the middle of the night and pouring motor oil under our plants. Well, that's what we call toxins, and many of us have to deal with that today. Okay, so that's our normal lines of thinking, right? Now let's apply that to a wilted human. Okay, most of us will go on the internet when we have our problems. We're looking for answers here, and the most common site is WebMD. So we punch in all of our symptoms and complaints, and the first thing that pops out is, what medical condition do they have, right? Well, that's normal. Okay, what's the problem? What's the problem? And then the next thing is, when it should be, what are we going to do to fix it, right? Just like with the wilted plant. Well, the next thing that pops out with WebMD is, what drug do they need? What happened to the way that we were thinking before? When we find out what's wrong with something and then just fix it so it can start to heal and repair itself. What has changed our thinking? Well, the drug and pharmaceutical companies are spending billions of dollars a year to teach you how to do this now, right? Yeah, and that's pretty sad. Now, I want you to understand right up front, I am not against medications, okay? So don't go empty all your medications out and say, Dr. Filippini told me not to take them. That's the furthest thing from the truth of what I'm telling you to do right now. Medications are there, but they're there for a purpose. They're there for a crisis situation. It's kind of like the analogy of your house being on fire. If your house is on fire, who are you going to call? Not Ghostbusters, right? It's going to be the fire department. So the fire department comes, and with all their equipment, their hoses and their axes, they're going to cause a little bit more damage to their house, but it's going to put the fire out. So the next day, when the fire's out and everything's back to normal again, do you call the fire department back to come in and start repairing the house? No, you don't. Now it's up to you to start to make the changes, to rebuild, to do the repairs. And this is what medications are for. They're there to help you to get through the crisis, get that blood pressure down, get your diabetes, your sugar under control, or whatever your problem is, and then make the necessary changes so you can get off of those medications. Because if you continue to take those medications, what it's doing is shutting your body's innate intelligence down so that it can't overcome whatever that disease is, and it becomes more and more dependent on those medications. And then it's going to require another medication, because that's going to cause symptoms, just like with your diabetes. You might have started off with some metformin for that, but then, oh, wait a second, now your cholesterol's a little bit higher, so now they got to put you on those statin drugs. Oh, now your blood pressure's higher, so we got to put you on the blood pressure medication, right? And now you're starting to get depressed because you're on all these medications, you don't have any energy, so they have to put you on an antidepressant, and you can see where this is leading to. It's just one thing after another. But the medications are not there to be for a lifetime answer for you. Now, I want to talk to you a little about your immune system, and you'll understand why in just a moment here. But your immune system has two sides to it, two basic sides, your Th1 and your Th2 side. Now, the Th1 is your initial response. They're kind of like these little Pac-Men. They go around and they see the invaders, the bacteria, the viruses, the parasites, whatever, and they go and gobble them up. Well, these guys are kind of nearsighted. They can't see very well. So that's where the Th2 comes in. And there are markers. They go around with these little taggers and they spray paint on all the bacteria. So now the Th1 can see them and respond faster and do a faster, better job for us. Well, something can happen where one of these gets out of balance. If either side gets out of balance, what this is going to cause your immune system to do is become overly aggressive. And when this happens, it can start to turn on your own tissue and take out innocent bystanders. For example, if it attacks your pancreas, you develop diabetes, which is the reason I wanted to talk about the immune system. Now, it can attack your thyroid, and then that turns into Hashimoto's disease. A lot of the times I'll have a thyroid talks or dinner talks for my thyroid patients or potential patients, and I ask them, okay, how many people have a thyroid disorder? And usually, 80–90% of the hands in the room go up. And then I'll ask, okay, how many have Hashimoto's disease? And maybe 1 or 2 hands in the room will go up. But yet, with the thyroid disorder, 80–90% of all thyroid disorders are caused by an autoimmune disease, Hashimoto's, that's causing the problem. And nobody ever ran the test, so nobody ever knew that that was the underlying cause. And it's treated completely differently than just putting everybody on thyroid medications. You have to get in there and balance the immune system out. Or it could attack the myelin sheaths, and this can turn into multiple sclerosis, or it could attack the brain, and then this turns into Alzheimer's. And this is a big thing with diabetics, because first of all, when you're a diabetic, your blood starts to become very thick, like molasses, and so you can't get the blood into the small blood vessels, and so it becomes very thick and gluey, and it can't carry the oxygen and then again get the glucose to the cells, and this starts to cause the brain to shrink up. In fact, this is what they call a type 3 diabetes, is Alzheimer's. Alzheimer's induced by diabetes, because it's becoming so prevalent today. So not only is if you have diabetes, you have that strike against you. Now, if you have an autoimmune disease, it could actually be attacking the brain tissue itself. Now, if it attacks your joints, we know this is rheumatoid arthritis, or your uterus, we know this is endometriosis, or it could attack your stomach. This is sometimes called pernicious anemia, or it can even attack your bones. Most people know this is osteoporosis. So whatever tissue that's being under attack, eventually you'll get enough damage so then the medical people can make a diagnosis and at least tell you what tissue is being damaged. And unfortunately, once you have one autoimmune disease, you have a 50 to 60% chance of having a secondary autoimmune disease. Now, I want to talk about some myths about diabetes today. Now, the first myth is that diabetes always gets worse. Well, if you're trying to treat it with medications, you're probably right. But according to the Center for Disease Control, they stated that diabetes is not only preventable and controllable. Well, I'm going to take it one step forward. They didn't say this. It's reversible. It's reversible. And I know that for a fact because we see this in our clinic all the time. Now, another myth is that diabetes is genetic, and you just have to learn to live with it. Well, that's not the truth either, because lifestyle can trump genetics. Any type of genetic disease is only 3 to 5% attributed to genetics, okay? That means the rest of it is caused by the lifestyle. Now, I know some of you are watching this and saying, well, I know it's genetics because my parents were diabetics, my grandparents were diabetics, all my brothers and sisters are diabetics. It's genetic. Well, let me tell you a little story. You may have even heard this before. It was about these 3 generations. They came together to have their Christmas dinner, and for the first time, the daughter's getting to make their meal. And she's preparing the ham. So she takes the ham in the kitchen, chops off both ends of the ham, sticks it in the pan, and the husband says, oh, hon, why did you do that? You cut off both the ends? That's good meat. Well, she says, well, I don't know, my mom always did it, so I've always done it. Well, go ask her, she's here. So they went and asked Mom, and she says, well, I don't know, your grandma always did it that way, so I did it too. So Grandma's there, so let's go ask her. So they go and ask Grandma, and Grandma says, well, my pans were always so small I had to cut off the ends to make the meat fit in the pan. You see, we tend to follow the same things that our parents and our grandparents did, the same habits. We eat the same foods. We do the same things. So it's not always genetics. A lot of the times it's just learned behavior. Now, another myth is as long as you take your medication, diabetes is not that big of a deal. Are you serious? My goodness, no, with diabetes, it's not under control. All you're doing is manipulating the numbers on your lab work. You're not fixing anything. In fact, you have a 2 to 4 times increased risk for gaining weight. Because with diabetes, this is a hormonal problem. All your fat storing hormones start to get turned on. All your fat burning hormones get turned off. So what we do with our patients is we treat them and teach them how to turn those fat storing hormones off again and turn the fat burning hormones back on, and not just for a couple hours or a couple of days, but for the rest of your life. Wouldn't that be better than having to go into the gym every day, spending 45 minutes, 60 minutes on the treadmill and you just run, and then if you forget to do it for a couple of days, you start to gain weight or you slip? No, it's so much easier when you learn how to address these the proper way. Other problems with diabetes is neuropathy. As I mentioned before, you have a 70% risk, 70%, not risk, 70% of diabetics will develop a neuropathy. Now see, the nerves are damaged. Again, when that blood can't get into those small blood vessels and affect the nerves, they start to die off. And this is a very common problem with diabetics, is the peripheral neuropathy. And that's a burning, the numbness in your feet, the tingling, sometimes in your hands and your other extremities. And so yeah, that's not a good thing to have. And then there's a peripheral vascular disease, because that blood can't get into those small blood vessels. We start to see issues like in the hands and the feet. The feet get infected and you can't get the blood and nutrition to them, so they become infected. That's why so many diabetics end up having amputations of their feet. And then heart attack and stroke, 4 to 5 times the increased risk for a heart attack or stroke. Now, 50% of patients with cardiovascular disease, the first symptom they ever experience is sudden death. That's not a good symptom to experience, folks, right? So you want to find out what the cause of the heart disease is, because if you can reverse the diabetes or your pre-diabetes and get rid of that risk there, you're going to be so much better off here. And then there's the eye disease. That's the #1 cause. Diabetes is the #1 cause for blindness. People lose their sight. Same thing for the kidney. Kidney failure, the #1 cause for kidney failure. The blood just can't get into those small blood vessels, and so they essentially die. Then there's the burden on the family. I mean, who wants to put the kind of a burden on their family where they have to take them in for dialysis 3 times a week, or lead them around the house in a wheelchair, or they're, because they can't see or they can't walk anymore. And these are the things that end up happening with diabetics, is that they need other people to help them out. And when you find out that, hey, I could have avoided this, or I can do something about it right now, wouldn't it be much smarter so you don't have to put that burden on your family? But I tell you this, as a son, I would much rather go through the burden of taking care of a loved parent or a grandparent than to be faced with the loss of life. And I think everybody should watch the movie every year around Christmas time, It's a Wonderful Life. Remember Jimmy Stewart, he gets a chance to see what it would be without him if he was never born. You touch so many people with your life. So many people love you. And you might feel that you're not doing much or adding much or doing anything, but you are touching lives. And God has a purpose for you on this earth. And if you're still alive and breathing, you haven't finished it yet. He still has more plans for you. So please don't let this be something that you just end up giving up on, when it's something that you can take control of and turn around. So we want to talk now about how to defeat diabetes. How do we do it? Well, the first thing we want to do is control the insulin surges, because diabetes is about 2 different things. It's about glucose and insulin. Anytime you have a meal, your glucose levels start to rise, right? So now your pancreas knows that it can make that hormone insulin, which is going to help the glucose get into the cells, to get it out of your blood. So when the pancreas secretes the insulin, then insulin acts like a carrier, a car, so then it can carry the glucose right into the cell. So then your serum glucose levels, they come down. The energy or the glucose goes into the cells, your energy levels go up, right? Well, when this is happening all the time, your body starts to become resistant to it. This is known as insulin resistant. Anytime you have elevated hormones in your body, your cells start to respond like there's not enough of it. It starts to listen, it stops listening to the message. So it's like, mom that has a little nagging kid pulling on her dress all day, "Mommy, mommy, mommy." She just eventually learns to tune them out. And that's what your cells do, is they tune out the message of insulin. Well, and then what that means then is the glucose can't get into the cells. So the doctors then, the way they treat that is they put you on medication, put you on insulin and other insulin-like products to try to carry that glucose into the cell. But all this does is slowly causes more and more insulin resistance. We treat this a little bit different in our office. What we want to do is decrease the insulin resistance. We resensitize the cells through specially formulated products. So at that point then, when you have the glucose in, the insulin can carry the glucose back into the cells, so the serum glucose levels come down, your energy levels come up, and you start to feel a whole lot better. Your life starts to just be, take on a whole new meaning. Now, another problem is that your lab test may have been coming in normal, but you still have diabetes or pre-diabetes. Now, why is that? This is because of the way they do lab work. Anytime you go into a lab facility to have any lab work, what they're doing is plotting you on a bell-shaped curve. And everybody that's been in the outer 2.5% on either side get rated with an H or an L for high or low. Then everybody else in the middle, that are 95%, is considered normal. Now, is 95% of our population normal? Absolutely not. 95% of our population isn't even not insulin resistant. They have issues. So what we do is we look at functional ranges. These are the numbers that are a lot more narrower, and these are the group of people that have no diseases and no symptoms. So normally your hemoglobin A1C, that's what they try to monitor to see how your diabetes is doing. They're going to have ranges anywhere from 4.0 up to 6.5. And again, it's going to vary from lab to lab depending on where you have the testing done. So if you come in at, let's say, at a 5.8, they're going to say, okay, you're within that normal range. But with the functional ranges here, our functional lab ranges are between 5.0 and 5.4. This tells us right off the bat, you are in a state of insulin resistance. So we're going to see your cholesterol start to go up, your triglycerides are going to go up. We're going to want to take a look at a lot of other markers to make sure this is actually what's going on. But then we can catch it, we can address it. Because if you're coming in at 5.8 and the doctor says to you, okay, well, you're insulin resistant, that's what your other doctor says anyway, right? Well, what are we going to do about it? Well, let me check you back in a few months and we'll see how it's doing. Are you serious? You want to wait till I become a diabetic before I do something? Let's be proactive. Let's start to make some dietary changes, whatever it takes, nutrients, whatever, so those cells can start to heal and resensitize them to insulin so we can stop you from becoming a diabetic. If you're already a diabetic, yeah, we can still reverse that and make those repairs. Now, if you're insulin dependent, if you're type 1 diabetic, yeah, we're not going to be able to, make your pancreas work again. And that's what type 1 diabetes means is you can't make insulin anymore. You've completely burned out your pancreas. The only way you can fix that is with a pancreas transplant. So what we can do is fix all the other things in your body that help to regulate your glucose, resensitize the cells so you don't need as much. Because if we can lower your requirements for insulin, we're going to get you feeling a whole lot better and extend many, many years of healthy life onto your lifespan here. But if you're not to that state yet where you're dependent on it, we can still do a lot. We can still stop this and turn it around for you. So how do we go about doing this? Well, we do it a little bit different than our medical profile is. If you go to the doctor, in fact, this is out of the World Health Organization, they stated that 90% of all diseases prevalent today are not treatable with orthodox medical procedures. So what that means is, let's say you have a raging temperature, okay? You're going in, you have a strep throat infection, the doctor puts you on some penicillin or antibiotics, and it clears it up. Have they treated the disease process effectively? Yes, they have. That goes down as a win. It messes up your digestive tract because it killed off all the other good bacteria, but they fixed the problem. But when you're a diabetic, and they put you on the blood pressure medication and the cholesterol medication, and they put you on the metformin and all these other medications, how long do you have to stay on those for? Forever, for the rest of your life. So have they treated that effectively? No, they're just managing it. See, it's kind of like this. Let's say you're driving your car and your engine light comes on. So what do? Well, you take it into the mechanic, right? So the mechanic says, okay, there's nothing wrong with this. I can fix this. I just, put you up on this little job here, put you up on the lift, and I'll have a machine that I'll hook it up to, and the engine light goes off. Great. Okay, so you drive home, you're all happy again, turn on the engine in the morning, the light comes back on. Okay, you're a little frustrated, so you take it back to the mechanic, say, my engine light came on again. Hey, sometimes that happens, so let's put it back up on the rack here, and I'll plug it back in here. They hook it up, the engine light comes back off, so you drive home. The next day, same thing happens. This time you're a little bit more irritated, and you say, I can do that. I'm as smart as that mechanic, so I'll go out and buy my own machine. So you get your own machine that turns off the light. So every morning you go out there and you plug it in and it turns off the engine light, so you go to work happy. Now, every time you do that, every time you plug that machine in to turn off the light, is your engine getting better or is it getting worse? It's getting worse, right? Now, what happens every morning when you get up and you take your cholesterol medication, your blood pressure medication, your metformin, or whatever insulin products, whatever else you're taking, are you getting better or are you getting worse? You're getting worse. That's right. And as long as you keep taking those medications, your health is going to continue to deteriorate. So what's the answer to that? Well, first of all, we want to order the correct test. It's not just looking at your A1C, at your fasting glucose. We want to take a look at a lot of things that are helping to regulate your glucose. Because along with the pancreas, your liver, your adrenal glands, your thyroid, and your gut, they all help to regulate your serum glucose levels and getting it into the cells. So these are the things we want to take a look at. So we want to then find out what's the underlying cause. What's the true underlying cause? Wouldn't that be terrible to be put on metformin and something, for insulin when it was never really the insulin problem to begin with? Yeah, it could have just been something going on with the thyroid. Well, yeah, they get those numbers to come down because they've manipulated them with a drug, but they didn't fix anything. So the thyroid or the adrenal glands continues to break down along with the pancreas because it's having to make more and more insulin. So we want to focus on the cause and not just the symptoms. Because what happens when we focus on the cause of the problems, our symptoms go away, right? You treat the underlying cause, then the symptoms are corrected. So we want to correct the dysfunction. We don't want to just alter the labs by putting you on a bunch of drugs. Then we want to address the body as a whole, because you can't just address the sugar and the insulin because there's so many other players in this. Have you ever heard of cortisol? Yeah, cortisol is a hormone that your adrenals make, and it makes this during the nighttime while you're sleeping to regulate your glucose, so then your pancreas kind of gets the night off. Now, have you ever woke up in the middle of the night, say, 1, 2, 3 o'clock in the morning, and you say, okay, well, that's probably because I have to go to the bathroom. So you get up and you go to the bathroom, and then you stop by the kitchen on the way back to bed to grab a bowl of ice cream or some cookies or whatever. Yeah, because your glucose levels were starting to fall and your cortisol levels spiked, and that woke you up. It didn't wake you up in a panic or anything. You just woke up and you said, okay, I might as well go to the bathroom. So you blamed it on that. But see, if we can fix the adrenal glands, then we can start to address one of the factors, and then all of a sudden you start sleeping through the night and your glucose levels start to get a little bit better for you. Now, another problem is the gut, because anytime there's gut inflammation, this is also going to cause your cortisol to spike, and this is going to cause your adrenals to go into a state of failure or fatigue. So we don't want to have that happen. And the things that's going to cause inflammation in the gut are food sensitivities. So many of us have so many food sensitivities, and we're not even aware. If you're a diabetic, the first thing I want to tell you right now, if you want to have any hope of reversing your diabetes or even lowering that A1C level, you have to get off of wheat. Wheat is one of the worst things. And what do they tell you when you go to the Diabetic Association and tell you what kind of foods to eat? Tell you want to eat a lot of whole grains, right? Eat cottage cheese, and these are all carbohydrates, and the carbohydrates are the problem. And wheat is just so bad because it's been modified with gluten, and they spray it with Roundup. Every one of the Americanized wheats, before they go in and harvest it, they spray it with Roundup so it'll yield a larger harvest for them. And this is toxic to our system. Can you imagine sitting down and eating 1 or 2 teaspoons of the Roundup just right out of the bottle every day? When you start looking at how much of that spray is going on to all the products that have wheat in them, That's the kind of exposure we're starting to get to, and this is accumulative in our body. Now, another problem is the leptin. Diabetes is a hormone problem. Leptin is a fat-burning hormone, actually a fat-storing hormone. When the leptin levels start to go up, it tells your hypothalamus that, hey, we don't need to store any more fat because we have enough stored up. But because just like insulin resistance, you can become leptin resistant, and the hypothalamus stops hearing that message, so it just keeps storing fat and storing fat and storing fat, and it gets out of control. So one of the things we teach our patients to do is to turn that hormone off. So we turn it back down again, and then you're resensitizing the hypothalamus to that leptin. So all of a sudden now you start slowing down your fat storing, and we start turning on your fat burning hormones. And this is done on a permanent basis, and again, not just for a day or two, but for the rest of your life. Now, another thing we want to do is take a systematic approach. Have you ever tried to do research or find out how to take care of your health, by going on the internet or watching things like Dr. Oz? One day they're saying, okay, well, you need to eat a nice big bowl of cereal. Don't eat eggs because eggs are bad for you. Oh, wait a minute. Okay, next week no, eggs aren't that bad. Just eat the egg whites. The egg whites are good. Wait a minute. No, now we need to eat the egg yolks because that has all your omega-3s in them. So we're kind of confused. Well, wait, don't drink coffee. Coffee is bad for you. And then they have another one comes out next week and says, no, coffee is actually good for you. It prevents cancer and all these other things. And don't eat butter, though. Butter's bad for you. Eat margarine. Margarine is so much more healthy. Oh, wait a minute. Don't eat margarine. You see what happens? You just get so confused. You want to throw your hands up and say, I'm just going to eat whatever I want. If the experts can't decide what's healthy and what's not healthy, how am I supposed to be able to figure it out? Well, this is something we do help our patients with. We show you the science behind it, and most of these things are marketing issues. They're just trying to market. They're put out by the meat and the dairy people. Milk, it does the body good and stuff. That's not scientific or a health organization telling you that. That's the dairy. Milk is not good for you. In fact, it's so packed with hormones and antibiotics. Even it didn't do all the other damage that all the milk does to you. It does so many other things, but that's one of the things that we're going to teach you about in our office here. The other thing we do is mentor our patients. You ever seen that movie Wizard of Oz? Dorothy, she's trying to find a way to the wizard so she can get home. Now she had to follow the yellow brick road, right? So along this yellow brick road, she has a lot of obstacles and barriers that she runs into, right? And who are the people that help her to get around those obstacles and barriers? They're her friends, the Tin Woodsman, the Scarecrow, and so on. See, that's what we do in our office. Everybody is going to run into barriers and obstacles, and we've done this long enough that we know how to help you get around those, because everybody's unique. You're going to have your own unique set of problems, but we're going to help you to find what those problems are and then help you to get around them. So what we do in our office is we address the person as a whole, and we put together what we call a curriculum by using 5 pillars of health. And this is what we start off with all of our patients, because these 5 pillars of health are absolutely essential to any disease process. The first one is detoxification. We are exposed to so many toxins, about 60,000 of them, more than 60,000 today, that we weren't just 40 years ago. And they start to accumulate in our liver and our stomach and our gallbladder. And when that happens, our liver starts to lose function, and that's when we start to see the cholesterol levels go up. We start to see our liver enzymes increase, and all sorts of other problems. So we have to teach you how to detoxify that and get it all cleaned out so it can do its function. If you don't do that, it's kind of like driving a car around without ever changing the oil filter. It's going to start to have an adverse effect on your car's engine. And we also need to clean the gut out, because the gut starts to get lined with all this slime and stuff from all the standard American diets and things. It's lined with parasites, bad bacteria. So we help to tear down all that junk and replace it with all the good bacteria. Very important is getting that detoxification going. Then we teach you about proper nutrition. You have to learn what foods to eat and what foods to avoid. Not just wheat and dairy, but there's a lot of other things, specifically things like GMO foods. Genetically modified foods are one of the worst things for us, and they're coming out with more and more studies today to show how this impacts, causes increased food sensitivities, causes genetic mutations, so it can actually turn on cancer genes. It can actually start to turn on autoimmune response. responses, so many bad things with that there. And so some of the things, yeah, you do need to learn to eat organic because they're not genetically modified. Other foods, yeah, you can save a little bit and buy them because they're not so sprayed so heavily with all the pesticides and everything. But we're going to teach you about those things. And we're also going to teach you about vitamins, because a lot of people don't understand. You can't just go down to the store and get your vitamins, you know, at Walmart or Costco, and because most of them are synthetic, first of all. Now, synthetic vitamins are things that are man-made. They're not real food, so your body doesn't recognize them, it doesn't absorb them, and it doesn't utilize them the same way. Kind of like your ascorbic acid and vitamin C. If you look at your vitamin C, it says 500 milligrams of vitamin C. Vitamin C is not found naturally in those high doses. So if it has that much in it, you can tell right away that's synthetic, but it usually says in the form of ascorbic acid. So that's like eating the shell of an egg and thinking you're getting a whole egg. No, you're just getting the egg shell. You need the whole thing. Synthetic vitamin B is made out of coal tar, petroleum products. This is so unhealthy for us. So you need to learn to eat good products that are organic, they're plant-based, and some of them you can use animal-based, like glandulars for thyroid replacement, but not getting all the sprays and everything on them. In fact, and they did a study, went into Walmart and Target several months back. You may have read this article where they pulled from the shelves to find out what was in them, and 80% of the products didn't even have the nutrients that they were advertising on the labels that they had in them. Can you believe that? You're spending all that money on all these vitamin products that you aren't even getting what you thought you were getting. So yeah, you need a good, reputable nutrition company. The next thing we teach our patients is about proper fitness. Do you have to exercise to be healthy? Well, yes. I'm afraid you can't get around that. But it's not like you think. Most people think you need to be in that gym 5 or 6 days a week, hour and a half a session. No, you need to work out 2 to 3 times a week, only spending 30 to 45 minutes per session. If you spend more than that, it can actually become detrimental to your health. It actually can cause you to start to retain fat in your weight, and it can actually put stress. If you're doing the wrong kind of exercise, it can stress your cardiovascular system. Aerobic exercise, for example, is just one of the worst exercises you can do. So if you're getting on that treadmill and spending 30, 45 minutes on that, you very might well be asking for a heart attack. What we want to do is teach you how to build muscle, because it's a muscle strengthening and boost activity that causes the good things to happen in your health. For every pound of muscle we put on you, we're going to increase your metabolism by about 1,500 calories per month. And there are special techniques that you can use to get this fast and effectively. And we'll teach you about those things. The next thing we do is teach you about hormones. And diabetes is one of those diseases that's a hormone imbalance. In fact, 70-75% of all diseases have an underlying hormone problem with it. And then we need to teach you about the nervous system. Now, why is the nervous system so important here? Well, we know that all the information on how the body functions is contained up here in the brain. That information travels down the spinal cord, out through the nerves to all the different tissues, telling how it's supposed to heal, to regenerate, to do their things and everything. Now, if you have a misalignment in your spine, which causes, comes from some type of a trauma, an automobile accident, sports injury, whatever, that will change the mechanics of the spine. If you change the mechanics, the way that joint moves, it'll start to get inflamed and irritated. Then it'll start to swell up and put pressure on the nerves that come out, and then those nerves can't flow the way they're supposed to, because you put about the weight of a quarter on a nerve, and it will decrease that nerve flow by about 50%. Not a good thing to have happen. So as chiropractors, that's what we fix, is we fix the spine. But there's another thing that's even just as important, and that's the connection between the brain and the gut. Because these two have a relationship where if one shuts down, the other is going to follow suit. In fact, they did a study a while back demonstrating this with little rats, where they induced these traumatic brain injuries, bonked them on the head, and then within 6 hours, every one of those rats developed a leaky gut. I don't know if you know what a leaky gut is, but your intestines are designed to hold your food in it as it empties from the stomach into the intestines, while it breaks down your proteins to the amino acids, your carbohydrates to the glucose, and the fats to the fatty acids. Then those small little molecules can get in through the little brush borders of the microvilli of the intestines into the blood, and then it brings the nutrition to all the different parts of your body. With a leaky gut, those little barriers, they stay open like stuck elevator doors, and so all those undigested proteins can get directly into that, along with the the bacteria and viruses and parasites. Or with an autoimmune disease, it'll actually start to eat away those little brush borders. So now you've got just all sorts of problems. And when your blood is being flooded by all these undigested proteins and bacteria, your immune system goes crazy. Just like we talked about before, that Th1, the Th2 starts to get out of balance, so then it starts to attack your tissues. And this is the basis of many autoimmune diseases, is just getting that gut fixed and get it repaired. Well, on the other side of the coin is true as well. If your gut breaks down here, then your blood-brain barrier is going to break down, because all these toxins and undigested foods start to eat away and dissolve the blood-brain barrier. In fact, one of the studies that came out a while back, an article stated that on an autopsy of people over 65 years of age, 1 out of 3 of them had some degree of neurodegeneration, like Alzheimer's, that had contributed or actually caused the death of the patient. 1 out of 3. This is new, folks. We have not had this problem, not 50 years ago, not even 20 years ago. And this is happening because our gut has been damaged. And I think a lot of these GMO foods, the types of foods that we're eating, plus all the toxins, the heavy metals, and everything else that's getting in and affecting that blood-brain barrier. So we need to address that and make sure that we're addressing all those areas. So this is what we call a curriculum, a basic curriculum, the 5 pillars of health. So if we were putting a curriculum together for you, which one of these pillars would we want to leave out? Well, the answer is obviously none, right? Because any one of those, if we neglected it, it could be to the detriment of your health. So we have to address all of those. And you may have been through other programs, weight loss or diabetes programs, that, doc, I tried that before and it just didn't work. I didn't get the results. It wasn't lasting or whatever. Well, did they treat you as a whole person, okay? Did they, first of all, teach you about your nutrition, the types of vitamins, the kinds of foods to eat, the types of foods to avoid? Did they teach you about the proper exercise, the kind of exercise you need to be doing, not all the aerobic exercise or even exercising at all? Did they teach you about your hormones, which hormones have to be brought back into their normal routine, and how to test for those to tell if they're in the functional ranges, not just, out in the general ranges with everybody else? The next thing, did they teach you about your nervous system? Did they teach you about how the brain and the gut function and work hand in hand, and how the spine has to have all the normal mechanics without putting impingement on any of the nerves? Did they teach you about the leaky gut and the leaky brain, how to repair those? And finally, did they teach you about detoxification, how to clean out the liver, the gallbladder, the stomach, to repair that? And by the way, if you had your gallbladder removed, you need to be on supplements for the rest of your life to replace the effect that that gallbladder once had. So these are the things that we're going to be teaching you about you. So if they didn't address all these things, that may be part of the reason you didn't get the results that you wanted. Next, did they have a system? Because 94% of all failure is due to not having a system. In fact, if we didn't have a system, we wouldn't get the results that we have here. There has to be an ABC approach, or it's going to become too overwhelming and things just wouldn't work the way they're supposed to. And finally, did you have a mentor? Did you have somebody that was down in the ditches, the trenches with you, practicing what they're preaching? I am an autoimmune patient. In fact, I was a pre-diabetic patient myself. So the things that I had to learn how to take care of myself are the things that I'm going to pass on to you. So I'm not just going to tell you to stop eating these foods and start doing these things. I'm going to show you how to do it, how to replace them with things that are still enjoyable, things that you're going to enjoy eating and doing, and it's going to make it very, very simple for you. Now, if you wanted to learn to fly a plane, could you do it from reading a book? No, probably not. Yeah, you probably need to take a class or two. And then after that, you might even have to touch a plane or even get into the plane, right? And then when you're finally sitting in that seat to take off for the first flight, who do you want sitting next to you? Yeah, you want your instructor, your mentor, somebody that knows the ropes so that if you run into problems or have any issues, they're going to know how to guide you through this. That's what we do with our patients in the office here. Yes, we need to address all these different pillars of health, but you're going to run into some unique things that are going to be very specific to you that we're going to help you to get around those. Make sense? Now, there's Chinese saying that says, tell me and I may remember, show me and I will remember, but involve me and I will understand. Now, of all the things that you've learned here today watching this video, what's the most important thing that you need to know? Well, let me give you a hint. It's the involve. Because all this other information is completely useless unless you put it into practice, unless you do something with it. So please, if you don't even come and see me, start implementing some of these things. But we have this enemy that just waits for us to, shut down and distract us and prevents us from doing anything. And that's this guy here, the procrastination. Procrastination is our health's biggest enemy. And in fact, 42 hours from now, on average, 42 hours from now, you're only going to retain about 7% of the information that you've watched here today. 7%. Now, a lot of that stuff is vital for you to know and to understand here. So I'm urging you to do something with it right now. Don't wait any longer. Act right now so you don't have that procrastination setting in. Pick up your phone and give us a call at 209-823-1163 to schedule an appointment to come in and see us so we can start showing you how we can reverse this and permanently get your health, your life, and your youth back. Now, the reason I'm going to bring this up here is because so many people do it wrong. If you're going to come in to see me, we're going to send you a lot of paperwork, and it's important that you fill out all of it here because that's what's going to help me to structure the curriculum that's going to be very specific to you. If you leave out parts, it's going to leave big gaps in your care that I would otherwise might be able to put together. So fill out all of the answers, all the questions on the pages there. And you're probably wondering, okay, well, what's the cost? What's this going to cost me? Well, we have a special going on right now. Okay, normally our consultation, our neurometabolic examination, our plan of action is $295. And I tell you, I don't know if you've been to any specialist, they charge anywhere from 2 to 5 times that just for you to see them. In our office, well, we're going to give you a discount on that if you act on this right now, and that's only $95. So you just can't beat the price on this. $95, we're going to take an hour of my time. I'm going to sit down with you. We're going to go through your history. We're going to do a complete neurometabolic examination on you. We're going to look and see how it's affected your nerves, your brain, your cerebellum, the peripheral nerves. We're going to take a look at your thyroid, your digestion, your mineral absorption, take a look at your gut function. You're going to see some amazing things from this examination, but most importantly, you're going to know where you're broke and what we can do to fix it. Now, is $95 going to cover my time? Not really, no. But I don't want there to be a barrier that might keep you from coming in to the most important appointment it could be for the rest of your life. Because if you don't come into this appointment, I can't do anything to help you. And you're most likely not going to make these changes or do these things that I've been trained to do all by yourself. Now, the other thing about the $95 is that this tells me you're ready to take this serious. You're ready to start to get your own skin in the game and start investing in your health, because it is going to take an investment to get your health back. The one thing I do ask, though, is please bring your spouse. If you're married, bring your spouse. And the reason I want that is because you need him or her for your support right now, okay? They are going to be making these changes most likely with you. You're going to be eating different. You may be sleeping different. Your activity levels are going to be different. It's going to change your life, all for the better. And hopefully this is going to affect your spouse as well. So please bring your spouse along with you. The other thing is, if you're like my wife and myself, we like to talk about all of our financial investments before we make those expenditures. In fact, when we first got married, we said we're not going to spend over $25 without talking with the other person first. And we've kept to that rule. And even though that number has gone up a little bit, we've never had an argument over spending. You shouldn't have bought that or whatever. So if you are the type that needs to, talk to your husband, or your marriage depends on that, please make sure your spouse is there for this, because during this hour, the examination, you're going to learn more stuff than you're going to remember. There's no way you're going to be able to take this back and present this to your spouse and show them all the things that we do in our office. You're going to come in and you're going to see some of the different technology that we have in here, things that you you have never heard of before, but I tell you, you're going to be impressed with it, and I want both of you here to see that and understand how easily we're going to be able to reverse your condition and turn this around and get your health back for you. The other thing I do ask is that you be on time. Have your paperwork filled out and be on time, because we run a really tight ship in here, and if you don't fill your paperwork out, it's going to take you a good hour to fill that out. I'll just be honest with you right up front. If you don't fill that out, you're going to spend your hour in here filling it out, and we won't have time to see you. So please have that paperwork filled out and be ready, because this is going to be a great time that we get together and talk about you, your health, the goals that you want to attain, and we're going to show you exactly how you're going to be able to do those. Now, these programs are not for everyone, and I'll be honest with you up front. They're only designed for those that truly want to see some significant results and are willing to put in the effort that it's going to take. In fact, what we're looking for are the A and the B students. The A students are the ones that are say, Doc, show me what to do. I'm going to do it. I'm there. I know our medication stuff is not working. It's not helping. It's not benefiting me. Show me what to do. The B students are the same way. They're just not quite as disciplined. They tend to fall off the wagon, and they don't take as many notes, but they're okay. I work with most of the patients in that category anyway. But if you're an A or B student, I'd love to work with you. The C students are ones that are always dragging their feet. They say, you know, I've got to talk to somebody about this, or I want to think about it. It's just that their health isn't a priority, not where it needs to be yet to do one of these programs. But if you're an A or B student, I would love the opportunity to help you change your life. Now, I want to answer some questions that you might have here before you call. One, will your insurance cover this? It's not that we don't take insurance. It's just that insurance only pays for sick care. They don't pay for well care. They'll pay for your drugs. They'll pay for surgery. Sometimes they'll pay for, you know, types of therapy. They'll pay for diagnostic tests, and you know, if they cover that, we'll be happy to use them. But if they don't, we'll use them and get things done at my cost, all the testing. And there's a significant difference in my cost, what I pay for testing versus what the public pays for. And we're going to save you a lot of money doing that in itself there. Okay? So another question that I get asked a lot is, you know, what do these programs run? Well, that's a big scale here, because some people have just been diagnosed with, you know, insulin resistance. They're just starting to find out that they have this as an issue. Others have been diabetics for years. They have thyroid complications. Their pancreas is burned out. Their adrenals are gone. You know, there's just so much repair work that has to be done. So it's really going to depend on how sick you are. So that's why it's so important that you fill out your paperwork completely and as accurately as possible, because then I'll be able to tell you exactly what it's going to cost you to get into one of our programs. But understand, most of our patients that we see in here are, you know, on fixed budgets, single incomes, or retired or whatever, and we still manage to make these programs, you know, fit into their budget. And we have different ways of paying for it, and you know, if you can afford, let's say, $200 to $400 a month, you can even fit into one of our more elaborate programs. You know, we have different ways of financing it, like, you know, Care Credit. Care Credit is a card that you can use for any type of health care expenses. A lot of parents will use these for putting braces on their kids. They can't afford to spend $5,000 or $10,000 to have braces put on, so they put it on Care Credit. Then you can pay as much or as little as you want. You can pay it off, you know, as fast as you want. So if you don't like to pay interest, or, you know, even give you discounts to help with the interest on that there. Or if you want to, you know, pay up front, we give you discounts for that. We even have in-house financing. But I just want you to be aware that, yes, it will take some financial investments of your own, because this is something that your insurance is not going to pay for. They're only going to pay for the things that you're presently getting, all those medications and any of the tests like that. But we're going to take this outside of the box because we want to fix this and we want to make this permanent for you. Another question I get a lot is, can you help everyone? Well, the answer obviously is no. There comes a point of no return. Once the pancreas has been burnt out, I can't bring it back to life. I can still do a lot of other repairs, but you know, there are certain things that once you're gone, it's gone. But it makes me think of one patient that I had come in just a few months ago. In fact, his name was Mark. And when I sat down with him, boy, I thought, wow, this guy's really sick, really heavy, and he was having some issues. And anyway, I sat down with him, and we kind of agreed that, yeah, you need this one here because it's very important. And when I finally sat down with him, I let him know that I kind of suspected that he was sicker than he thought. In fact, on our next visit when he came in, I presented all the lab work and everything, and I said, hey, Mark, if you hadn't signed up for this program, I don't think you would have been alive another year. And the thing is he looked me square in the eyes and he said, Doc, I know, and that's why I'm here, because I knew inside me that I wasn't going to make it. But anyway, I wanted to show you his testimonial, so if you just take a couple minutes to watch this. Okay, we're here to monitor Mark's progress. He's been under the program for about 3 months now, and we just met a little bit ago, and he's telling me how his progress is doing. He's been off his medications for his diabetes since May...
Actually, May 7th, and I've been off all medications.
All medications, okay. And we're in June 15th right now, and how's your glucose levels doing?
They range anywhere from about 90 to about 100, 103.
A little bit of progress, no medications.
And they were 384 and above before I started.
That's right. How much weight have you lost?
About 75 pounds.
75 pounds, not bad for 3 months' work. Mark's a startup pupil, though, and when you put the effort into doing this and following it, you can get these kind of results.
And I have energy to walk.
That's right, yeah. What else has changed?
Well, that is a big change. In April, about a month ago, I could walk about a block and I would have to rest. I'm doing about anywhere between 6 and 10 miles a day now.
Wow, that's fantastic. Fantastic. Good. Anything else in your health change? You noticed some aches and pains? I know you were...
My back problem's not as bad. Everything's improved. I mean, literally everything has improved.
Fantastic. All right. Well, we appreciate you taking the time to share, and we want to maybe follow up on you in a few months to see how you're progressing.
With another 50 pounds.
That's right. That's right. All right. Thanks, Mark. Thanks for sharing. So I can't guarantee these kind of results for every person, but Mark is one of my ace students. He took it serious, and we're getting some fantastic results. I can't hardly wait to see where he is in 10, 12 months from now, but he's just making some fantastic progress. And we do see a lot of typical results like that with our patients, but 75 pounds, in 3 months' time, that's pretty good. That guy's, he's out there walking. The energy that he has now, the difference in his relationships with his wife, his kids, it's just fantastic. So anyway, the bottom line is, if you're ready to get off of this highway that's leading to your destruction of being fat, sick, and depressed, folks, this is your exit. So please don't make any excuses, not for yourself, not for your spouse. I hear people say so many times, I'm just not worth it. I'm not going to put my spouse through these costs or the efforts and the changes in their life. You are worth it. God has a plan for your life, and if you're still alive and breathing, He has something in your plans. Now, there's a scripture that says that the thief comes to kill, steal, and destroy, but Christ came that you might have life and have it abundantly. Now, if you're listening to those lies that's saying you're worthless, that you're not worth putting the investment of the time and the energy into getting your health back so you can enjoy the rest of your life and really do something with it, your enemy has already won. But I'm here to tell you, that's not the truth. You are a beloved child of God, and He has wonderful things in store for you here. And I hope that you will call our number today to come in so we can start to get your life back for you. So thanks for watching today. God bless you, and I hope to see you soon.